This is our official session on breastfeeding support and where to find it. And we're specifically focused on Northern Ireland. And I'm delighted to have such an amazing panel here with us today. And we're going to kick off with a chat with Mairead Mulligan, who is a midwife with Sure Start. Mairead, do you want to join us and tell us a little bit about your role?
Hello, everyone. And I'm been very honoured to be here today and on the launch of Breastfeeding 21. Yes, I'm a Sure Start midwife, have been for 15 years. I've been a midwife for much longer. Sure Start has 39 different programs and projects throughout Northern Ireland, and I work in Glenbrook Sure Start, which is based in North Belfast. We within Sure Start, we work with the 0 to 4 years, and it's a program, and of course 0 to 4 years obviously includes antenatal, and that's a huge part of my work. And I suppose then we along with two other Sure Starts, Smile Sure Start and Shankill Sure Start, have been awarded the Baby Friendly Gold Award, and we're very proud of that because we are the first Sure Start in Northern Ireland to have achieved that award, and we're delighted to have it. And with that, then, you know, I work promoting breastfeeding, and I try to influence women who probably might not have even thought about breastfeeding as a choice for them, due to Sure Starts being based in the most deprived areas of Northern Ireland, and very often it's an uphill battle and an uphill struggle, but we continue. And over the last, I suppose, 13 years, we have been involved in the Baby Friendly program. So I see myself as an advocate for breastfeeding, and an advocate certainly for the women within Sure Start. Everything we provide them with is you know, gives them the tools to make really good choices, and everything is evidence informed information, and that's to make sure that they can make choices, and we optimize in the care for mothers and babies. It's a very holistic service. We take in the whole family, and communication, relationship building and partnership working is huge. That's everything that I work with. The pandemic has been a very difficult time for all of us, but I see Sure Start as probably not altogether going back. We have taken up different types of communication skills, and we'll probably continue to go forward with it, simply because we feel that we can get to a wider, bigger audience instantly, and I suppose that's through our WhatsApps, Birth and Beyond, which I set up in March 20, and it has been a real fantastic way to keep in touch with our parents, give them up-to-date and evidence-based information. And it's also a way of all those mothers keeping in touch as well, giving them a clap on the back if they, you know, if they feel they've achieved something. And you know, from where I'm coming from, any kind of breastfeeding is wonderful. We have to start off with that first feed. And very often women might not go beyond that, but you know, I have to say to those women, like, wonderful, you've tried it, and I have been amazed by the achievements of our Sure Start families, and how they have gone forward and achieved much more than they ever thought they would. Within Sure Start, it is a needs-led organisation, and we continually strive to improve the lives of families, and certainly breastfeeding is a part of that. Communication and relationship building is also absolutely crucial, and we will continue to do that over the years. Sure Start is funded by the Department of Education, and the Sure Starts throughout Northern Ireland would be led by trusts. Some are independent, and some are early years led. But our aim is certainly to improve and include parents in how we go forward. At the moment, we've started up our groups again, very small groups, 4 or 6 parents and their child. But throughout we have done things like one-on-one doorstep visits, walks in the park, teddy bear picnics. So it has been challenging, yes, but it certainly has been enlightening to see a different way of working, and a different way of engaging with parents. And we hope to go forward with that, and continually optimise the care to mums and babies.
Fabulous, thanks so much, Mairead. And it's so lovely to hear that the pandemic, while a huge challenge to many, many families, has also been a catalyst for really positive changes in services, so that people can get access to services in different ways now that they wouldn't have been able to access before, which is amazing. And we'll be sharing on social media. We have a summary of all of the breastfeeding support groups that are available, facilitated by Sure Start across the whole of Northern Ireland, and we'll be sharing that out through our social media as well. But there are a huge range of support services out there, both online and, as you said, Mairead, lovely to see face-to-face groups getting back on, I was going to say online, offline again, which is excellent. Thank you so much, Mairead. Now we're going to switch over to Katie Lynn, who's a breastfeeding counsellor with the NCT. Katie, if you would like to tell us a little bit about the work of the NCT.
So my name's Katie. I'm a breastfeeding counsellor at NCT. NCT, National Childbirth Trust, is really well known in England and Scotland, and it's lesser known in Northern Ireland, but we are working on that. We currently have 6 breastfeeding counsellors, 2 students that are going to be entering into their breastfeeding counsellor training, one of them being Catherine on your board, which is super exciting. But we also have antenatal practitioners, and what NCT does is really work with parents. The focus is on the first 1,000 days of parenting, and that takes us through antenatal. And within the antenatal courses, there's a session that focuses on breastfeeding, and we focus on breastfeeding because research has shown that women are unable to achieve their breastfeeding goals due to lack of support or lack of knowledge in those antenatal days, and the importance of that. So we facilitate these sessions to parents, which is wonderful. All our training is parent-centered, which you see, I believe, in our practice, because locally we run drop-ins, which is any breastfeeding count. So Mairead, you'll appreciate that we champion anything that the families want to do, and we really want to encourage that support, so they do feel that they can achieve what they want. So currently we're online with our breastfeeding drop-in. That's on a Sunday afternoon, and then we're looking at moving that to one evening a week, and continuing to do the weekend support as well. But you can also access the breastfeeding counsellors. We have a Facebook page where women just drop us a message, and one of us always comes back to them. We offer Zooms at the minute if it's something that women want, need a bit more than just a typed answer. And we work on really listening to the mother and encouraging them to work through what they're doing rather than being simply advice. It's really focusing on the well-being of the mum and listening to what they want to achieve and how they feel that they could best be supported by us as breastfeeding counsellors. One of the things we were asked to consider whenever we were given the opportunity to come on to this panel this afternoon was what encouraged me to want to pursue becoming a breastfeeding counsellor and working with women and parents across the board. And for me, it really was wanting women and women parents to achieve what they want where breastfeeding is concerned. I believe that there's so much expectation of 6 months and a year, and what if women only want to do a few weeks? Well, that's wonderful, and they deserve to be celebrated and encouraged and to feel as though they can access support. And also just about being a mum that is breastfeeding, has breastfed, demystifying it. So it seems there's such an attitude where breastfeeding is concerned that it's only for certain classes, certain people. And I want that to change. I want it to be something that it's accessible to everyone, that it's not just viewed as certain classes. And I really, I will talk about breastfeeding any opportunity I get, in the hope to demystify that, and in the hope to talk about, break down these, you can't do that if you breastfeed, and you can't do this if you breastfeed. And it's very much about having that conversation that, well, actually, you wouldn't have women that continue to breastfeed if you couldn't do A, B, and C. So that's, I think, we're all quite on par with, on the same level across the board with NCT, and that's how we focus. We just want to share, we want to talk, share information, demystify it, and support women to achieve what they want, and listen to them.
Amazing, thank you, Katie. And I think that comes across so strongly, the passion that there is there, and the attitude of breastfeeding counsellors and leaders within NCT and the Leche League. I've experienced the support myself, that it is absolutely non-judgmental and working with families to get to where they want to go, not telling them what they should do or how they should do things, to listen and understand and support them to get to where they want to go. Thank you so much, Katie.
You're welcome.
And next up we have Sandra Hewitt. Sandra is infant feeding lead, and I know that she also trains peer supporters and does a whole range of other activities. And I'm going to welcome Sandra. How are you?
Hello. Hi. Thank you so much for the lovely introduction, Jennifer. And it's an absolute privilege to be here and to be part of Breastival this year, because it's always such an exciting, enthusiastic event, and we always come away from it feeling inspired again and re-energized and feeling excited about going forward. So I'd also like to wish you a very happy 5th birthday.
Thank you.
I had a big birthday party here last night for my daughter, so I'm just still looking a bit disheveled after that. But and would you believe, at our dinner table, as always, we discuss breastfeeding. And I have 3 daughters who were all breastfed, not as well as I would have liked to with the amount of knowledge that I have now. But one of the quotes that we always talk about is Oprah's quote: "We did the best we can, and we do the best we can with the information that we have at the time. And when we know more, we do better." And, I my eldest daughter had her first baby, my first grandchild, last year. At the beginning, just at the beginning of lockdown. And I was so privileged, so blessed to be at the birth of baby Reuben, who is just a total joy, a total star, a total delight. And Joanna says to me, "Mummy, do you tell people about Reuben?" I said, "I just can't stop telling people about him." And we got skin to skin right at the beginning, because she is known from she was a tiny tot that breastfeeding was important, as all of my girls do. And so she, straight away, she got him skin to skin. He got onto the breast just when he was ready, and he was just never away from the breast. And one of the important things that I kept telling her was, you can't overfeed your baby. You can't spoil your baby. Lift your baby, cuddle your baby, love your baby, comfort your baby. And as we know, that precious oxytocin that we're all so blessed to have surging through us, just helps everything else fall into place. Everything just, falls into place when we've got that oxytocin. And I look back to when I had my children, and I was told, don't lift your baby, you'll spoil your baby, you'll make a rod for your own back. And I looked at my babies and thought, I want to lift you, I want to look at you, I want to cuddle you, but I better not. So that breaks my heart sometimes when I think of back then, 30 years ago, when I was told that. And I wish I had listened to my own mothering instincts, which told me, lift your baby, cuddle your baby, hold your baby. I think that is the most powerful thing that we can tell mummies. And I mean, I go around the ward every day and say to mummies, strip your baby down, get your baby skin to skin, hold your baby, cuddle your baby. And, I've gone off on a complete tangent here. I don't know, that's not in any of my notes. But sorry, I think that the beautiful speech at the beginning and listening to everyone else has really made me feel that I need to go off on that tangent. So sorry about that, but I'll go quickly with the rest.
But you're so right, Sandra. There are so many of these odd ideas that we have in our culture that we nearly need to dismantle all of that stuff, and actually just start paying attention to what we know. Babies are gorgeous. We want to sniff them. We want to cuddle them. We want to squeeze them. So do it. It doesn't matter how you're feeding your baby. Just pick them up and hold them and love them.
Exactly.
Anyway, less tangents. Sandra, back on point.
So basically, I became a nurse, a midwife, way back years and years and years ago. But then I became a lactation midwife when I completely became inspired with breastfeeding. And then I was lucky enough to work with fabulous people like Janet Calvert and Baby Friendly Initiative. And we achieved Baby Friendly Initiative in the community. And then I got the post about 12 years ago as infant feeding lead, breastfeeding coordinator in the Southern Trust. And we then worked, and back then we only had early stages. We had stage 1 and a credit and certificate of commitment. Then I worked through those years to progress to full accreditation across the Southern Trust, which we're so pleased about. We've still a lot of work to do, but we have come a long, long way. And now I have to say, I get absolute joy with my specialist role, supporting mothers like Maria there says, mothers that may not have chosen to breastfeed, but because of things at delivery where we say to mums, your baby's rooting around, why don't you try a breastfeed? And they start to breastfeed then. We have fantastic antenatal infant feeding workshops. And I do a lot of training with pediatricians, with dietitians, with peer support volunteers, and I'm absolutely inspired by those wonderful women who volunteer their services, like Nuala, who is in your group. And Nuala, I am so proud of Nuala. She was one of my students, and she is absolutely fantastic. I work with 10 wonderful women who encourage each other and support each other and support mothers out there in the community. So thank you to all of them and yourselves. So I also work with great people like Pauline, who's speaking at the end, who's a baby friendly professional officer, and people from Sure Start, from the obstetricians, the pediatricians, NCT, Lelesh, and Facebook NI. And I would get referrals from a lot of these people for specialist referrals. I qualified as a lactation consultant about 8 years ago, and then as a tongue-tie practitioner just last year. So I have seen a lot of changes over the years and the days, but I like to think that I change with and keep learning. It's all about lifelong learning as well. And we have, as Maria had mentioned, relationship building is very important, partnership working. We all work together with the coordinators right across the trust. We share information, we support each other, and we ask each other questions. If someone else has had previous experience that they've supported a mom, we get that information from them. We have our skin-to-skin protocol in theatre, which I'm really excited about, across Daisy Hill and Craigavon. In theatre at caesarean sections, we make sure that the mum has her baby delivered completely straight onto her chest, skin to skin, and it's just wonderful. The mothers have less pain, less nausea, and the babies sometimes root on and just start to feed on the theatre table. And this is wonderful because I'm working with anaesthetic nurses, anaesthetists, and all the other staff around who see how important breastfeeding is. We also colostrum harvesting, which is really important, gets the mums expressing their colostrum early and knowing how to express when they come into hospital, and having that wonderful, amazing colostrum to give their babies, especially if the baby's at risk of hypoglycemia. So I've probably gone over my time. I haven't really looked at any of my notes. And the other thing I wanted to say was, I remember reading The Politics of Breastfeeding, which was inspirational. And I'm so excited that you've got Gabrielle Palmer, because she is just inspirational, and definitely inspired my interest and enthusiasm from way back. So thank you so much for the time. And
thank you, Sandra, and thank you for the tangent. It's lovely to be reminded of the babies and the loveliness of them. But also, I think you've made a really important point about the importance of connection between women and their babies, but between all of the people who are working to support breastfeeding in the community, in the health service, that we are connected to each other and talk to each other and are all working together for the same goal of helping parents to get to their feeding goals. Thank you so much, Sandra. And as you mentioned, I'm going to pass over to our amazing board member, Sandra. You're proud of her. We are incredibly indebted to have Nuala as part of Breastival. She is some woman for one woman. She does the work of about 10 people all at once. Nuala, I'm going to pass over to you. I can't find you to spotlight you. Nuala is going to talk to us about her role as a peer supporter.
So thanks very much for all the kind words, and I hope everyone can hear me okay. So I'm Nuala, and I'm a trained peer supporter within the Southern Trust. And peer supporters are mothers with experience of breastfeeding, and we have a qualification in breastfeeding support. And I was very, very privileged to have received my training from Sandra, who you all know is with us today and on the call. And I remember Sandra telling me as part of the training, and it's something that has stood with me throughout, which is the importance of finding, where possible, a breastfeeding solution to a breastfeeding challenge. And for me, that is very much the core aspect of local breastfeeding support. Breastfeeding is wonderful, but as new mummies and new families, we sometimes have to learn how to breastfeed, and our babies are learning too. And that's why there are peer supporters who you can reach out to at any time with any question. No question is ever too big or too small. We're always here to help, and we're connected into a wider team of people who can address any issues that require further support. And often the questions and queries that we get are associated with latching on, and we have plenty of tips and suggestions. And we're also a sounding board for questions about normal baby behaviour. So I was really pleased to hear Sandra's tangent, because in the course and the training that we did, Sandra had given us loads of information about how we work with women around the mythology of normal baby behaviour, and all of those things that Sandra said, like lift your baby, cuddle your baby, hold your baby, you know, offer the breast skin to skin, and that you can't overfeed your baby, are all really important tools when working with women in the peer support role. So as peer supporters, we're here as a source of information and support, but there are also, and obviously there's a lot of people on the call, many trusts, sure starts and organisations like La Leche League and NCT that offer local support. And as we transition on from COVID-19, many of these organisations, has been mentioned on the call, will begin to offer face-to-face support. And getting along to a support group can be a wonderful experience as a mother. It's a really good opportunity to connect with sources of support, but also to meet other mothers and families. So I remember attending the group at Mulligan Hospital, and to be honest, the first time I attended, I thought it was all a bit odd. There was loads of coffee and babies, but I went back a few times, and I realised that alongside all of the specialist support, there were also many women around me who could answer questions about weaning and going back to work in ways that I hadn't heard before that were very useful. And the more that you attend groups, the more you tend to see the same women out and about in your local area, things, you know, or in other places that you can be, and you can connect and make friends. And if you ever feel a little bit nervous about attending a local group, do reach out to your local peer supporter and have a chat about what it was like for them. And they might give you some insights or have some points about what it was like to attend a local group, or how to get to it, or even the times that they're on. So as part of Breastival, we have cards that outline where local support is and where you can find it in your area. And if anyone on the call would like a copy, just drop us a line and we'll send it on to you. So thanks very much to everyone for the opportunity to speak to you today.
Thanks a million, Nuala. And I think, you know, you've highlighted really well the importance of peer support, that quite often the things, you know, the random questions that we come up with in the middle of the night when we're feeding our baby, going, oh, how do I figure out what side I was on last? Or, you know, just those basic things that you think, I'm not going to bother my midwife or phone pay. Yeah, you have a peer supporter in your pocket that you can text. But also, you know, we want to mention that there's Breastfeeding in Northern Ireland Facebook group, which is an amazing resource. It's probably one of the reasons that Breastival started in the first place, was myself and Jenny and the rest of the board members being connected through that group, that you have literally thousands of women with an amazing admin team in your pocket at 3 a.m. There's always going to be somebody there to answer your random questions or queries, or give you a little handout or a lift up, or celebrate with you when you get to your golden boobies or your sapphire boobies or whatever boobies you happen to be on at the time. So thank you, Nuala, and thank you to all of the peer supporters out there who've given up their time to train and to give their time to support other women to get to their goals. So next up we have Leslie Mccann, who is the infant feeding lead in the Southeastern Trust, and she particularly works with supporting the health visiting team.
Thank you very much, Jennifer. Thank you. And it's a privilege and a pleasure to be here today, to be able to represent Southeastern Trust at your Breastival event. So as you said, my name is Leslie Mccann, and my role title is Community Infant Feeding Coordinator within Southeastern Trust. So I'm based in the community, but I do have, as we've talked about, teams. I have very close working relationships with all the health visitors within the trust, midwives, and the other 2 infant feeding leads that are acute based. There's 2 based in the Ulster Hospital in Dundonald. And for anybody that doesn't know South Eastern Trust, it's a funny geographical area. It covers kind of Ards, Bangor, down the peninsula. There's kind of like a greater Lisburn sector as well, which incorporates Stewartstown Road over into the Belfast Trust. And then we have a way down sort of Newcastle, down Patrick area as well. So it's a kind of funny geographical spread, but in saying that, we're about 4,500 babies. So we're certainly very busy within the trust as well. Community infant feeding role really evolved, I suppose, from my health visiting post. My past kind of work life would have been in midwifery and then in the health visiting world, where I always was really passionate about supporting breastfeeding women. And from that, really, over the last 15 years, I've worked with the steering group within South Eastern Trust to try and get us through the various baby-friendly accreditations from, as Sandra was talking about before, I remember it well, from getting your certificate of commitment, stage 1, 2 and 3, you know. So we know that that is the way to go. We know that that is best practice, and we're very, very committed to that within South Eastern Trust. So we were very lucky in December of last year in 2020, with COVID going on and all the rest, we managed to, in South Eastern Trust community, achieve our Gold Award, which was very exciting for all of us, but particularly for the mums and babies who we serve within the trust, because, as we know, it's such good evidence-based practice. Part of that process, which I was very excited about, ensured that instead of breastfeeding and infant feeding being kind of an add-on to the health visiting role, we had to have a community infant feeding coordinator position within the post. So it was very exciting for me that I believe that's my legacy that I'm going to leave within the trust, is that we have secured a role forevermore, which will purely be around infant feeding. So that's huge. And I know the trust will benefit, and therefore the mums and babies within the trust will benefit from that. Looking at my role, really, it involves really, like the other girls have said, supporting, I'm really supporting health visitors and mothers within our population. Really, mums, I suppose, with the more challenging and complex infant feeding issues, in particular, maybe babies that are struggling to latch, mums that have maybe significant complex medical issues going on, or mums and babies who just have had very challenging experiences in their journey around infant feeding. And it's being there to be able to support the mums and be able to support the staff in making sure that best practice is achieved, and that mum gets the journey that she hopes to achieve with her feeding. And also my role is looking at what we're doing within the trust around infant feeding. You know, it's trying to kind of, I suppose, tie up all the loops and work within, we do have a great network within Northern Ireland, you know, from the other infant feeding leads as well. So there is certainly lots of joined up thinking within Northern Ireland, which is great. But, you know, it's looking at where we can go with this and to make sure that mums get the best experience all around infant feeding. So in South Eastern Trust then, as part of our Gold Award, we set up our Community Specialist Support Service. And that was just in February of this year. So health visitors and acute infant feeding leads can now directly refer into myself, and it's all about a team. So I have a small wee team working with me as well. The family health visitor and myself will then work jointly with a mum who's maybe struggling with issues around feeding. We do a home visiting support plan. I would go out, hopefully a joint visit with the health visitor who referred in. And it's great learning for both and great shared experience for the mum and baby, because they can, you know, they have that really good relationship already with their family health visitor. I am an added link then for support and discussion and offloading and all of the things that you do when you're out in a family home. It is very valuable, I think, to see mums and babies within the family home, and that's certainly something very positive that has been the feedback from mums and from the health visiting practitioners involved with the infant feeding support, specialist support. So as we've talked a lot about teams, we do have a strong team. We've got steering group reps sitting in every part of the trust who are the go-to person in their area if any of the staff are looking just to chat over a challenge that they're having with a mum and a baby who life is just a wee bit more difficult around infant feeding. So we signpost parents off to all of the valuable resources we have going on within our trust. We've got Zoom breastfeeding groups that have been going on right through COVID and are still, unfortunately, we're not back to face yet. We're still delivering a lot of the stuff by Zoom. We also have devised a QR code within our trust, which pops parents up onto this SET infant feeding page. Wealth of resources on there, fabulous list of antenatal workshop dates, all ranging right through to the video clips of position and attachment, hand expression, all the rest. So it's a valuable resource, and we try and in the antenatal period ensure that parents have that QR code for that link and follow-up support care. Peer support volunteers are vital within our role as well. And health visitors are really trying to work hard to offer antenatal contact as well to all mums, just to ensure that there is those really valuable conversations around infant feeding before even the baby has arrived. And again, signposting parents off to the antenatal workshop, inviting them to try and get antenatally into a Zoom breastfeeding workshop and to use the QR code. It's kind of joined up thinking really around all those things. But we are very fortunate. 89% of our mums will uptake an antenatal contact, which is great. From our health visit service, we've worked really hard to ensure that that happens. The role also involves obviously training of staff, lots of training of midwives, health visitors, community, child health assistants, maternity support workers. We've even got dietitians and speech and language therapists involved now as well. And when you think of the amount of care that they deliver to families as well, it is great that everybody is BFI trained, and we're all saying the same thing, which is great. And we're always looking, of course, at ways to try and address the reasons why not all mothers do breastfeed or have that successful journey, the barriers that they face, and how we can help in South Eastern Trust to address that. As it was touched on before, with great regional links, we're all in contact with the other infant feeding leads within Northern Ireland. So part of my role as well would be to link in with that and attend that National Infant Feeding Network meetings for discussion. Those are such valuable meetings, and it's only with the kind of all of us joined together are more of a force, you know, and Pauline can help lead us in maybe challenging government and challenging the PHA of things that we feel need to be addressed for women within Northern Ireland. And of course, the very valuable thing then within South Eastern Trust is for any mothers who are living within our area who are interested in supporting women within their community, they can train to become a peer support trainer. And Jackie Henning runs a wonderful peer support training opportunity for anybody who would like to become a volunteer within our area. And we have just actually appointed, funded by Public Health Agency, a link worker who's going to be based in the Ulster Hospital to ensure that all mums get referred into peer support very quickly within the first 48 hours after delivery, which is nice guidelines. We're very excited at that there will actually be a paid post for this peer link support worker as well. We know that people need support, mothers need support particularly quickly before they're discharged from hospital, and peer support offers that soft chain of support as well as the midwives and the health visitors. So it's very much a team effort within SET. I cannot highlight that enough. It's joined up thinking all the way. And the aim then within South Eastern Trust is for there to be robust support and rapid referral into that specialist support service if it's needed for all mums and babies within our population that we serve. Thank you.
That's wonderful. Thanks so much, Leslie. And that I think really gives a flavour of the role of the infant feeding lead. It's about supporting women, but it's also about improving the landscape more generally, training other health professionals so that they understand the importance of breastfeeding, they understand the importance of that relationship between mum and baby, and do what they can to support that, so that no matter who a woman comes into contact with within the health trust, that she will get boob positive support.
That's the plan.
Thank you so much, Leslie. And now we have Sarah Mccann, who is an IBCLC and La Leche League leader. I have to say that personally, Sarah has been a great source of support for me throughout my incidentally 5 years of breastfeeding journey. No coincidence that Breastable is 5 today as well. Sarah, welcome, and you're going to tell us a little bit about the support that La Leche League offers.
Thanks Thanks so much, Jen. Thank you for that lovely intro. Thanks so much for asking me along to represent La Leche League. And yeah, congratulations on Breastfeeding being 5 years. I think it's a huge achievement. It's really exciting. One of the great things about Breastfeeding is it brings so many people working in breastfeeding in different roles together, and we get to see what everybody else is doing. And it's teamwork is just so important, and it's going to be important in the future as we kind of go forward across Northern Ireland. How did I get involved? So I'm going to answer some questions that we were given in an email. So how did I get involved in La Leche League? Was 25 years ago. Well, it's a bit longer than that actually, but when my eldest daughter was born, I needed help and support from La Leche League and the NCT. And then as time went on, I heard of more and more women giving up breastfeeding because they were getting poor information, whether from various sources. So I trained as a La Leche League leader, and I've been a league leader now for 25 years. And yeah, La Leche League, we now have 8 leaders in Northern Ireland. And why do parents access support? Different problems with breastfeeding, there's still unfortunately a lot of misinformation out there in Northern Ireland. Many women, they find their families are difficult and not understanding about breastfeeding, and they come to League because they want that extra bit of support and encouragement. Some moms just come because even though their family is supportive of breastfeeding, they just like that bit of extra support as a breastfeeding mom, and love to meet other breastfeeding mummies. We still get women, yeah, they're being, unfortunately, sadly, there are still women getting given poor information, okay? It's a bit negative given that everything else has been so positive, but there are still women who are looking for information on positioning and attachment, looking information on medications, but we also do information on solids, women looking for information on solids, introducing solids, they're looking for information on weaning, looking information on going back to work. As Katie said from the NCT, we don't give advice, we give support and information. So try and help women meet their own goals. And yeah, not just women, we also reach out to the LGBT community. So for trans parents, LGBT parents as well, the various ways women and trans men and trans women can breastfeed, induced breastfeeding, induced lactation, etc. We've recently been, since the pandemic started, we've been doing our meetings via Zoom. One of the main things the Leche League leaders do is run meetings. And our Zoom meetings have been really interesting. At first I hated them. I resented that we couldn't be face to face. And I just wanted to see people. But then once I got past that, I realized that we were actually building a community online. And we were getting women coming much quicker after the birth, maybe as early as 3 days after the birth. We were getting women coming from areas that they couldn't have come to us before, rural areas where they would have had to travel further to a meeting. We were also getting women in their PJs and in bed. So we've had quite a lot of women lying in bed at our meetings. And that's great because they admit that they just couldn't get out to a meeting otherwise. So I see, even though the face-to-face meetings will get up and running again, of course they will, and it'll be more in the different areas where league leaders are, I still see us running Zoom meetings in the future as well, to improve and increase accessibility to mums. I think what keeps me going in League is seeing the relationships that mothers develop with each other, and we've seen that online. It's been great. Recently, I think since about Christmas time, we've particularly had a really close group of women who gelled really well and support each other beautifully in the meeting. It's just so lovely to see. I think with the meetings, I try and get as much information as we can out there to help those women, even if they're not training as peer supporters, but so that they can go and support other women that they meet, whether in their families or at the school gate or wherever, in work even. yeah, we have a chat, a messenger chat group. I think we're going to go to WhatsApp because I think it's probably a better platform. How can you access the LH League? We have the helpline, which is, if you Google the LH League, I mean, you should be able to see under my name. Yeah, I can see the spelling after my name there. So there's LH League locally in Northern Ireland, and we're part of LH League of Ireland. LH League of GB is a website that we refer to all the time. And LH League GB are part of LH League of International, and all of Ireland use the LH League GB Breastfeeding Matters magazine. So it gets a bit complicated, but we somehow make it work. We also have a Facebook page, LH League NI, and it can also seems to be, thank you, Jennifer, that's fantastic. I see in the chat you're putting up information for me. So the international website is information for parents. The LH League of Ireland website has information on the local groups, and the lha.org.uk is the GB website, and that's got lots of information on there for parents. How to get involved with the LH League is basically come along to meetings. Unless you're very remote, that is partly how you sort of get involved. LH League leaders, we offer support through the meetings. We offer support online to mums who are asking questions about breastfeeding, and you can ask anything about breastfeeding. We also do phone support. So we have a phone number, there's a helpline that mums can ring if they need support. And I had a mum yesterday, she was trying to contact me, and then we ended up talking after 9 o'clock last night. She phoned me. So it's kind of, we're there whenever mums need us. Yes, training with the LH League. Contact your local LH League leader and ask them about how you go about it. But you do need to come to meetings to get a feel for LH League, feel if that's the right fit for you. It's really exciting. There's so many more roles now that women have in terms of supporting breastfeeding. Obviously with the breastfeeding itself and all the volunteers involved, peer support, all the health professionals that are getting involved with breastfeeding support. It's not just one size fits all. There's so many different ways that women can get involved. Yes, and we have a training program. So the local leader helps train you, and we have a training department who does a significant part of the training as well. And we're an international organisation, so you can take the LH League training with you wherever you go in the world if you do travel, or it's very local, and we're all the same. It doesn't matter whether you've been a LH League leader for a day or for 25 years, we're all equal, and all have the same sort of say in what's going on. And part of our role is also to help train other women as breastfeeding counsellors, and run the group, offer the phone support and Facebook support, and sort of do the general admin as well. Is that it, Jennifer?
That's great. Thank you so much, Sarah. I think that, I'd like to just thank you and all of the LH League leaders and NCT leaders for giving so generously of your time and your expertise and your skill to support women in the community. I'm getting a little bit emotional already because even just the groups, the face-to-face groups, you've highlighted that, but part of it is just being around other women who are breastfeeding. So you don't even have to have a problem. The groups are there to be welcoming as a social space for when you've not been able to get out of your pajamas for days, that you want to actually just have a little bit of adult conversation with somebody else. That social connection is so important, in addition to the specialist expert support and information that you can offer. So thank you very much for joining us. And our final speaker that we have for this panel, I see there was a couple of hands up to ask questions. We're going to have questions at the end after Pauline. So Pauline Mccann is, let me get this right, Pauline Mccann has about 10 different hats. So Pauline is an infant feeding lead. She's also a tongue tie specialist. She's an IBCLC. She is the chair of peer support national group. She's also the chair for the Northern Ireland Infant Feeding Network. And so Pauline is going to come and talk to us about her various different roles. Welcome, Pauline.
Thank you. And I just also would like to congratulate Breastfeeding on the 5 years running. It is amazing to be speaking here today to all of you and to follow up on all those lovely talks that we've had from everybody. I'm really going to talk I suppose, from the health trusts within Northern Ireland, so the 5 health trusts that we have, and just give, I suppose, a broader picture across all trusts and what support is there for mothers. So my background, like Jennifer said there, I have a lot of hats, but they all interlink. So they all interlink, and it is an amazing job, and I do love it. So I am a midwife. Trained as a nurse initially, then a midwife about 18 years ago, and then became an infant feeding coordinator in the Northern Trust in Causeway Hospital about 5 years ago. And then just over a year ago, I took up post as well with the UNICEF Baby Friendly team as a senior professional officer. So as I say, I do have a lot of hats, but I am a lactation consultant, and I'm also a tongue-tie practitioner as well. So I suppose looking at overall support across the 5 trusts, we have a specialist referral pathway. So there is infant feeding leads in all 5 trusts, and they actually represent all areas of care where mothers come in. So if you had a baby that was born preterm, we have infant feeding leads in the neonatal units. We also have infant feeding leads covering maternity and covering the different hospitals, and also, like Leslie spoke there, regarding the health visiting services. So there is infant feeding leads across all trusts in the health visiting and public health sector as well. So they're covered right across the board. So how can you refer to an infant feeding lead? Really, each trust have their own referral pathway, but the easiest way to do it is to get your health visitor or your community midwife to do a breastfeeding assessment, and then identify what the issues are, if there is any issues, if you feel that you need referred through, and then your referral through is sent through then to the specialist support. So hopefully you wouldn't be waiting too long for that referral to come through, and a lot of areas we do have cover over holidays as well. So we have across Northern Ireland a new midwifery-led team of people who are midwives and have gone on to do tongue-tie training. So Sandra spoke there earlier, so from the Southern Trust, she does it. So in each trust, we are going to have a midwife that is trained in to be a tongue-tie practitioner. So we're really proud of that service, and a lot of work has been put in by the Public Health Agency and by Janet Calvert, who's the regional lead for that, and putting that work through and funding those courses. So we have attended a university. It is a university accredited program, and the other thing regarding that is, and there is a lot of talk about tongue-tie and a lot of referrals being done, just because the baby may have a little bit of frenulum underneath the tongue, it does not mean that the baby cannot feed and cannot breastfeed. So we would encourage mothers to, while they're waiting for a referral to come through, to continue to feed their baby and to get support then from your community midwife or your health visitor meantime before that referral comes through. But we're very proud of that service, and it is work in progress. So each trust is at different stages within it. In the Northern Trust, we have 2 clinics. We have a clinic set up in Antrim and in Causeway, and then in other trusts, I'm saying that because I work in the Northern Trust, so I work as an infant feeding, but in each other trust there is their own infant. In the Western Trust, they have it as well. Southern Trust is work in progress. Sandra is trained, and Belfast Trust, they have their clinic set up as well. And I know in the Southeastern Trust, it is the girls are trained or have some of their training done. So that is really, really proud of that work. I chair the regional tongue tie group meetings as well. So all those infant feeding leads come together. So we try and have, you know, a care that's provided right across the trust. So no matter where a mum will give birth within the trust, that she will get the same care. So we also, I also, chair regional peer support. So looking at, you know, training peer supporters across Northern Ireland, looking at how we can work together within trusts and within as infant feeding leads. So a new project that was brought in maybe in 2018, we have breastfeeding peer support link workers who work in each hospital, and they pick up referrals. So mums that have delivered and are going home breastfeeding or mixed feeding and would like to be referred out to another mother, so peer support or a mum who has already done some training. And that is done throughout Northern Ireland as well. So we're very proud of that work, and it is working really, really well. So that's another part of my job working. I also work for the baby friendly team, UNICEF, so I work with them 2 days a week, and I represent Northern Ireland for the baby friendly team. So I suppose just a little bit of background about it. It is a global program, and they look at promoting health and well-being of all babies and all children. The baby friendly standards provide a roadmap for services to improve care. So in Northern Ireland, we are very lucky, and we have worked really, really hard as infant feeding leads that we are 100% baby friendly accredited. So where a mother would give birth across Northern Ireland, you are giving birth in a baby friendly hospital, which is great. So this baby friendly accreditation is based on a set of interlinking evidence-based standards for maternity, health visiting, neonatal, sure starts. And we also have these standards brought into the university, and Queen's University, so where our health visiting students are coming through, are also coming through an accredited baby friendly service standard. So quite amazing as well. So these are designed to provide parents with the best possible care and to build close and loving relationships with their baby, and to feed their baby in the optimal choice that they decide how to feed their baby. So as I said, all healthcare trusts implement these standards, and there is a lot of work involved for infant feeding leads and for those teams surrounding them, working towards these standards. So that training is that it is accredited course. So, you know, training your staff members, training health visitors, is that I know what Sarah had said there is giving different information, mothers receiving that different information, you know, and that what we're trying to do is make sure that all that training that staff and health visitors are getting is from an accredited course, and hopefully that will work together so that they are getting evidence-based information then mums when they're at home. So at each stage we go through an accredited process, and once we get fully accredited, then you can go on for a gold award. And we know Mairead spoke there earlier about her Sure Start that is gold accredited. Leslie McCann, her service is gold accredited. We have gold accredited in the Western Trust, and in the Northern Trust, I have to boast a little bit, we were the first service to go forward as midwifery and health visiting together. So we were the first across the whole of UK to get the gold award across both services. So very proud of the amount of work you know, that we have put into that. But yes, our breastfeeding rates are really low in Northern Ireland, and it is what can we do to improve this? So looking at that culture, looking at our communication, I think is really, really important. Listening, that simple task of just listening to a mother, finding out what information she already knows, finding out where her goals are and moving forward. And a lot of that communication is covered across the baby friendly training. And then those I suppose the curriculum then is passed on from the baby friendly team to infant feeding leads, and then that training is cascaded then to all other staff across each healthcare trust. So we train midwives, we train maternity support workers, we train pediatricians, we look at children's nurses as well, so training of children's nurses, ensuring that if a mum was readmitted, that they get the best possible care and that they're able to maintain that breastfeeding journey, and are supported with it. Okay, so another final hat that I have is I chair the National Infant Feeding Network, and that I have the privilege of saying that I chair that group. What an amazing group of women that I work with, and work very closely with Janet Calvert as well, who funds an awful lot of courses for healthcare workers, attending the annual UNICEF conference, the neonatal conference. A lot of funding has been provided for staff to attend those courses. So I'm very, very grateful for that. So this network is where all infant feeding needs across Northern Ireland that work within the healthcare trust meet about 3 times a year. We get feedback from each area, how each area is doing. We can, I suppose sometimes there's no point reinventing the wheel. So if somebody has something that's working really, really well, then we can try that in other areas as well. So it's about sharing of information, it's about networking, and it's across all areas. So we have got Sure Start, we have got clinical education, we have got university leads and infant leading leads as well coming to that meeting. So it is something that we ensure that we go to about 3 times a year, and a really, really good networking and support as well. So there's been a lot of changes through the COVID pandemic, a lot of training that has changed to online. That has been very really, really hard for us as well as infant feeding needs, just to change from face-to-face to online training. How can we look at training staff to support mothers within that? So is it through phone calls, looking at Zoom meetings, looking at our training online, the different styles of learning, and it's just all incorporated. So it's a big, big minefield, and I do think that we will move forward much better with it as infant feeding leads personally, and as group. I really, really feel, with training and how we deliver that training. So looking at that hybrid, maybe a little bit face-to-face, which we do need that face-to-face as well, but also looking at online as well, maybe an e-learning element, looking at things like that. And UNICEF, the baby friendly team, have been amazing in sharing loads of documents with us. So if you were to go on to the UNICEF breastfeeding baby friendly initiative page, there is loads of resources there for mothers online, loads of videos, and also for staff when we are supporting mothers. And I think really, I probably have gone over time, so I'm really sorry, but I think that's really there is a lot of work going on in trust. There is, we have for antenatal mothers getting ready for baby program. So that's a lot of parent craft there for mothers, and there is breastfeeding elements. We also have separate antenatal breastfeeding workshops, which is a 2-hour workshop for mothers. And this is all online. So mothers that maybe previously wouldn't have attended, maybe working all day, come home and think, oh, I'm not going out to that meeting, can actually pop online now and be able to attend a breastfeeding workshop online. So there is, loads of ways there of getting support, and never feel that you can't ask for help or support. In each trust, no matter where you have given birth, there is a pathway that you can look for specialist support. And then, of course, our peer support program as well across all 5 trusts. So I'm going to hand you back to Jennifer. Thank you very much for giving me the opportunity to talk here today. So thank you.
Thank you, Pauline, and thank you everybody else who has joined the panel today. And I think, Pauline, you said it there, for any women who are watching this in Northern Ireland, you are not on your own. Sometimes it might feel like you are when it's 2 a.m. and you're sore and baby's upset and you're not sure what you're doing, but you're not on your own. There is a huge network of support that's available to you. So the onus is on you to make that step, to reach out, because know that the support is there, the support is available to you. All you need to do is reach out and ask for it. Sometimes you might have to ask a couple of times, but it is there for you and you can access it. And you know, breastfeeding rates in Northern Ireland have been low for a long time, and so of course things aren't perfect, but things definitely are improving, and that's, you know, evidence today. There's huge amounts of work that's happening throughout Northern Ireland to try to improve the landscape so that every woman can get to her feeding goals. And so I'm going to open up to any questions, and I know that Catherine has the first question that she's itching to ask, so I'm going to hand over to Catherine, and then anyone else who wants to ask a question, either type it in the chat or raise your hand and we'll unmute and you can ask your question yourself. Catherine.
Thanks so much, Jennifer. It's actually following on something that Pauline did bring up there. It's a question for all of our panelists, and what do you think needs to be done to increase breastfeeding rates here in Northern Ireland? And open it up to anybody.
I've been, oh, sorry, Sarah. I've been thinking about this, and it's something that actually myself and my husband talk quite frequently about. And I think that there's so much focus on a birth plan and the arrival of the baby being removed, kicked out of its squashy home. But there's such little focus on the postnatal period, and we know that that's whenever it becomes a reality. So what if we encouraged women to really have an action plan in place, to have those conversations about how they want to feed their baby, and to really build up the support so it's there, to have those conversations with their partners, with their surrounding family members, to go, listen, I want to breastfeed, and this is what is normal with a breastfeeding baby, and I'm going to be tired, but I need you to really ring fence and to protect this want in me, and to support my ideas, my desires to breastfeed my baby, because it's so easy to have that well-intentioned, well, just one bottle won't make, it'll be fine. And it's always done out of love and desire for the mum to get rest. But we know, working with breastfeeding mums, that we need to protect the dyad of the mum and the baby in those early weeks, those early days. So I would like to see more focus on that postnatal plan to really encourage parents to have those conversations, so they can the baby arrives and moving beyond the birth to implement a breastfeeding plan.
Great, thanks, Katie. I think Sarah had a hand up next.
Mm-hmm.
You're still muted there, Sarah. Pauline, do you want to come in and then we'll come back to you, Sarah? Is that okay?
Sorry, my mouse.
Oh, here we go. No, here we go. We've got Sarah.
Sorry, I couldn't get the mouse moving. Sorry. Technology. I love what Katie says, and I suspect that none of us are going to disagree with each other in this. I think we're all going to but we're probably all going to say different things, because there's so much needed in Northern Ireland. And I'm probably going to be a bit, I don't know whether some of what I say is probably going to be a bit controversial, but anyway. Firstly, I think we need more lactation consultants. We need more lactation consultants in the hospitals. And we need more lactation consultants in the dietitian community, and anywhere that works with mothers. It's a postgrad qualification. It was birthed out of La Leche League, in part, at least many years ago. And it is an okay exam. I mean, I've done the exam twice, and it's multiple choice. It's not scary. I remember going to a course that Janet laid on for us when I was redoing the exam. And sadly, too many of there were most of the other people on the course said, oh, it's too hard. It's not that bad. I would just say, please do the lactation consultants exam, please, out there, health professionals, it'd be great. We also need more midwives. We need more, this is the controversial bit, we need more investment in birth, because we know that birth is related to getting off to a good start with breastfeeding. And unfortunately, I think there's too much organisation of birth and not enough of women being allowed to birth the way their bodies want to give birth. There's too much induction. I saw that when I was working in Sure Start. There were women being induced for goodness only knows why. It was you kind of definitely got the feeling that birth was being scheduled by somebody. And there was a serious problem there. And it's probably a lack of investment, and we need more midwives so that there's more midwives available to deal with the surges in birth. Women don't give birth to order. They don't give birth evenly every day. There are surges, and yeah, so we need more midwives, more investment to pay for those midwives in the hospitals to cover that, so that it's not as organized. Two other wee things, medications. I felt in Sure Start when I was working there that women were being told by GPs to give up breastfeeding to go on meds. That was a serious problem. They were happily breastfeeding, and the medications they were on weren't a problem for breastfeeding, but the GPs were seeing them as a problem. So I think that's a real serious issue there. And I know that the PHA has been working on that for years, and it's a really difficult area, but I think it's really an area that's there. Yeah, it's really important area. And then the kind of lastly, sort of trauma awareness. Women can easily get put into fight or flight, and it can happen just after the birth. And it can happen when the baby's not well. So it's kind of a woman being asked, well, are you going to breast or bottle feed? And if breastfeeding isn't her natural thing, it seems to be an issue for women that they will then kind of go, oh, I don't know what to do, and they'll say, oh, just bottle. Whereas they actually had wanted to breastfeed beforehand. Or if they feel, if their baby's not well and they go into hospital and they are made to feel as if breastfeeding is a threat to their baby, then there can be a problem there. So, okay. If you want to ask me about that more, there's some of these topics. I mean, you could have conferences for days on some of those topics. So yeah, that's me.
Thanks, Sarah. Pauline.
Yes, hi. I suppose on what Katie was talking about there about support and in the early days is so important. So that friendly ear to talk to, or even that conversation before they have their baby, is really, really important to have that. And so every contact needs to count. So it really, really needs to make that effort. I work on the ward as well. I work on maternity. I am helping out through a pandemic. So I really feel for the midwives that are on the ward, and really, really feel the pressure that they are under. So I would hate to cause a blame game towards them. They are doing an amazing job in what they're doing. And yes, we do need more staff, but it's not from their want of looking for more staff. They're just, the staff is not there. So that is a bigger issue past us, where there is more staff and there is more midwives trained, and that we are getting more midwives in. But it doesn't always have to be a midwife. We have fantastic maternity support workers across all trusts that do an amazing job and have been trained, just the same as peer supporters. We need to utilize that so much more. So those maternity support workers that are going to go in and support that mummy at 2 o'clock in the morning or 3 o'clock, and that aren't going to just turn to a bottle as an easy fix. And we do an awful lot of work with those staff regarding that. So we also monitor our supplementation rates. So looking at how many mothers have, given a supplement during the night, and what is the reasons behind it, at what time of the night was it offered, was it clinical need, was it maternal choice, did mother make that fully informed maternal choice? So looking at a lot of that. So as early as possible, as much support as possible is really needed, and we do need more people on the ground. Exactly what Sarah said there, we do need more people on the ground. I don't personally feel that it has to be all lactation consultants. I think a lot of people could have good breastfeeding training, and amazing if they are lactation consultants. That is really, really great. But I don't feel in those early days that drop-off point from when a mum will initiate breastfeeding and give that first feed to her baby, compared to when the amount of drop-off that we have with mothers discharged home, we are losing a good 10 to 15% of mothers that actually don't go home breastfeeding from hospital. So that is a real area that we need to work on in that early, because if we can get through those early days and support the mother with that, it will make a massive impact to that whole feeding journey, and of course to mother's experience within the hospital. So
thanks, Pauline. Nuala wanted to come in, and I've got Mairead and Leslie. I can see your hands up too.
I just wanted to make a point which is from a slightly different perspective. So just thinking about breastfeeding rates and supporting breastfeeding, I think there needs to be a wider recognition that breastfeeding is a societal challenge, and a lot of the barriers that have been put in place that, you know, either prevent women from breastfeeding or result in women ending their breastfeeding journey before they are ready are societal. And there are lots of issues around family support, all those myths around normal baby behaviour, and all of the things, you know, that Kitty Lynn mentioned about people saying things that you can do or can't do if you're breastfeeding. So all of that, it was just to say, I think a dedicated program of work that really looked at how to address those kind of societal issues might see an increase in initiation rates and in the length of time that women breastfeed.
Brilliant. Thanks, Nuala. We've got some small people arriving in the background here. Mairead, I know that you had your hand up, and Leslie as well next.
Yeah, I suppose come from a Sure Start point of view, I'm thinking about the culture of breastfeeding, and very many areas it's not seen as the main time feeding that they would do. So I have over the years done different small bits of work with grannies or potential grannies, with dads, and this is so important, I think, now because of the 6-hour discharge postnatally. They are the people on the ground who are going to be there, and we need to engage with them and give them information and change that culture in the home. Because very frequently they're the people who have the ear of our women, and they're the people who will, with the best will in the world, will want to help that girl, and they think by taking baby and giving it a bottle is a lovely thing to do. And that is when these women are at their most vulnerable, and their most trusted advocate is by their side, the dad or their mummy, and that's who they trust, and that's who they'll listen to. So we need to definitely do a piece of work around informing and giving information to, and making sure that they are able to support these women when they go home in those very early days, because with the best will in the world, the community midwives will be in for maximum an hour on that first visit, and there's so many things to be done, and feeding is just one. area of that those initial days, and then you get to day 3 or 4, and the milk comes in, and the hormones are there, and you know, it sometimes is just a real tragedy for some of those girls, where they feel they just can't keep it together and go forward with their feeding, because just because of the hormones, and just because of maybe the pain that they're feeling, and the doubt they have in their head, you know, and we need to instill in them, you can do this. This is something that you absolutely 100% can do. And a little blip in your journey is not, it doesn't need to be the end of the journey. They need to know that as well. Very often they're not aware that, you know, even if the baby has had a bottle or a few bottles even, that they can go back, they can re-establish. It's never too late.
Absolutely. So go on ahead, Jennifer, sorry.
No, I'm balancing small screaming people, but we're all right right now. Leslie, you have your hand up, and then Ciara, you've had your hand up for quite a while, so we'll come to you next.
Yeah, just very, very quickly, just to pick up a couple of wee points there from Katie, Sarah and Pauline. Yeah, I feel as well in my world, working in community with health visitors, we are really well placed because we're going into the family homes. So I think that's a huge opportunity. That's why we've worked so hard with the antenatal contacts and increasing our antenatal contacts. We're filling out a family health assessment, which blends, you're talking about family health in general, you're looking at grandparents, anything that could pertain maybe to, you know, before the birth of this baby. And it just leads so nicely on to conversations around not asking, are you going to breastfeed or bottle feed, but just lovely responsive parenting conversations, which leads so lovely on to the feeding, the whole feeding aspect. And what we have really noticed within Southeastern Trust is the amount of partners, dads that are around, even granny. Anybody can come to that antenatal home contact, you know, as long as mom's happy with it. And we are noticing that usually you do get the couple, which is lovely. You know, they're listening to all of the information as well. They are realizing the impact of all of this on the future of feeding experience of this family and responsive parenting in totality, not just in relation to feeding. So I do think, like everywhere else, there's no midwives, there's no health visitors. I don't know what we're doing. We just can't seem to train and retain enough. We are working under huge pressures. But I feel even though we're working under huge pressures, as Pauline was saying with the midwives, we're making progress. So we're getting there. We're getting there. And just very quickly, we point that Nuala said about societal government agenda. There needs to be huge work done, and that's where NIFIN and Public Health Agency working with us, you know, are trying to address a whole lot of those things. We could talk about this forever, really, couldn't we? But thank you.
We absolutely could talk about it for a long time. Thanks so much, Leslie. Ciara, you've been patiently waiting.
Hi everybody. Well done to everybody. Great resources and everything there, and ideas and all. Just a little point back to improving breastfeeding rates. I'm down in Republic of Ireland, but I'm sure it's the same everywhere. When you're off on maternity leave or you're having your babies and you just Google search something or something on Facebook, you know, and I would block a lot of the big commercial breast milk substitute. I would never look at any of those stuff. But for the last while, I just said, I'll just have a look and just see, you know. And if you look up anything, it's amazing the stuff that comes up on your page and pops up. And this would all link in with the code. Yeah, they can't commercialize 0 to 6 months. But of course, the packaging after that and the focus now. Lately, I got on Facebook. I got a notification that Tesco's were, I shouldn't mention their name maybe, but a big brand anyway, sorry, a big company, a superstore, or doing a baby event. So I went to it anyway, and I went in and I saw one of the big companies that were sponsoring it is a breast milk substitute company. And there was dietitians, registered dietitians, and there was a sleep consultant talking at it. Now I know, like I'm breastfeeding nearly a 3-year-old tandem feeding and all, and I'm a midwife nurse and just a public health nurse down here, same as health visitor up with you. But it's massive what's going on, I think, in the background. And these big companies, if you look them up, and then they'll send you an email, and you know, a few weeks after you've had your baby, and it's just linking into that lack of confidence we might have in the few weeks afterwards. Like that all links into like the code and legislation of the code. So look, it's massive and there's big things behind it, but that's part of what I kind of wouldn't been aware of, because I never linked into those kind of things. But the other question I kind of had was for Sarah there. I lately linked into, which was one positive I think of Zoom, that you can attend any Leleshli Quidju Friends of Breastfeeding groups around the country, you know, and I'm in Leitrim and this was in Portlaoise, and I thought it was really good initiative. It's breastfeeding infancy, beyond infancy, so it's beyond 9 months. And I suppose, I know that the rates are not great above that, but I think they are starting to improve, and we need support beyond 9 months. So I thought that was a really good, and I'm not sure, is that happening up, Sarah, in Northern Ireland at the moment? I just thought that was a really good idea.
Portlaoise is a super group. They have lots of leaders. So yeah, we have mums who come with toddlers to our group. We encourage women. I think Leleshli League would be known for supporting women beyond the 9 months. Yeah, so we're very supportive of mums coming throughout their breastfeeding journey, and we assume that it's beyond. It's all, well, I don't mean to say, as Katie said, we help women meet their goals. But Leleshli League would talk about enabling children to wean at their own pace and respecting the child's need to breastfeed as well. So it's about a breastfeeding dance. But yes, Leleshli League in Northern Ireland, we definitely support breastfeeding mums with toddlers, and that's part of Leleshli League International. And maybe we'll get managed to diversify in terms of how we do Zoom and groups in the future. But at the moment, we're just kind of keeping it all together. But I think it's great though, when the mums of toddlers come to the group, they can support the mums with young babies. And they've been through those patches and, you know, the developmental stages, developmental leaps and brain development, and can really help and support the other mums. So that, yeah, I don't worry about our group that way. I'm delighted that Portlaoise can do the feeding beyond infancy stuff, but yeah, we do, yeah, we cover everything in Northern Ireland. Does that answer your question?
I was only wondering that specific group, but look, even people in Northern Ireland can link into the Portlaoise group, which is
yes,
fantastic,
absolutely, yeah. And some of our mums are thinking of this. I think Portlaoise are going to do something on solids, and I think some of our mums are looking at that because we haven't been able to do stuff on solids much recently. Although I think on Friday there was stuff on solids.
Yeah, that's what we found fantastic about that group was, you know, if you're just after having your baby and your baby's a few days old, and then somebody else breastfeeding toddler and they say they had a problem with the toddler biting or something, you know, something completely different that happens after 9 months. That's why the group was kind of nice, you know, to talk about other stuff that you probably don't want to mention to somebody who's, you know, that kind of way.
Oh yeah, absolutely. And that's what we do all the time. Yeah, we cover all that kind of stuff. We kind of, earthy is maybe not quite the right word, but sort of earthy, because it's not all medical. It's about the experience of being a mother and a breastfeeding mother, and you know, what is that actually like? Yeah. So
thank you,
Kara.
Amazing. We're almost coming towards the end. Would you believe we've been chatting for almost 2 hours? But Sandra Hewitt, I can see that you have a hand up. I'll let you pop in, and then I think we'll have to let everybody get on with your Sundays. Thanks all.
Yeah. Thank you, Jennifer. I just wanted to say, you know, I agree with everybody, especially those early days, extra support so that mothers will have a positive experience, and then that helps their friends and family to then want to embrace breastfeeding and want to do it because they've seen it as a good thing and they can see the results. Also really, really important what Nuala said about changing our culture, and I think we need to be actioning our government to embrace the full code of marketing of breast milk substitutes and not have advertising of follow-on milks on TV. Instead, we should be having things like tailor-made for tiny humans being shown all the time, because I think that just really makes us know that it's a good thing. And other advertisements like that to show our women that this is what we're supposed to do, just show society that this is how we breastfeed. our babies, that this is what our babies need. And as well as that, building each other up, having resilience, teaching women to be strong women, to know what they want, and to be able to do this, to believe in themselves that they can do this. And that's basically it. Thank you so much.
Amazing. Thank you, Sandra. And thank you, everybody, for being here. I think, Ciara, you raised a great point that we are working in an environment where companies are being allowed to market aggressively something that undermines the health of the population, and that's something that we should be pushing against quite hard. And this year is the 40th anniversary of the WHO code, so I would encourage anyone who's interested to join the event on Thursday that talks about the code and how important it is. But also we have our Politics of Breastfeeding Northern Ireland session on Tuesday, which is a listening exercise, so please do come along. That is an opportunity to speak directly to the chair of the Communities Committee in Northern Ireland and tell them all of these things that they need to know about what women and families in the community need to enable and protect breastfeeding. Thank you all so much for joining us this morning. It's been so lovely to see you all and to hear about all of the amazing things that you've been doing despite or sometimes because of the challenging 18 months that we've had in COVID, and more power to you all. And I hope that we'll see you again throughout the week.